Have you ever worried about the difference between chin implants and jaw implants? Well, my name is Sagar Patel. I'm a facial plastic surgeon in Beverly Hills, and in this video, we're going to explore all the nuances between the two different surgeries. So let's get started. Well, we're going to start with the basics. What is a chin implant? Well, a chin implant is inserted into your chin area to augment it. Chin implants can vary from a narrow implant that defines the central area to a wider implant that can be more square and define even the wings of the central mandible. Now, we have to understand a little bit of mandible anatomy to really understand what the difference is. In the mandible, we have the ramus, the body, the angle, and the menton. The menton is specifically the area that we're defining with the chin. Now, when it comes to the chin, we can have different areas of concern. We can have a recessed chin or we can have a small chin. Similarly, when we take the whole jaw, we can have a recessed jaw or a small jaw. Medical terminology refers to microgenia or retrogenia as small chin or recessed chin, and retrognathia or retrogenia as small jaw or recessed jaw. The first important step is to determine which of those you have. When it comes to the chin, we want to assess the overall shape of the jaw in relation to the chin. What's the width of your chin and what's the shape of your jaw? Is this portion of your jaw longer than this portion? And if so, how can we correct that? Now, when it comes to the jaw, there's subtle shapes that are involved even as they correlate to the chin. The shape of the angles, I would say, is the most critical aspect. A well-defined jawline is one in which we can see the angle and see the chin. What's in between won't be as important or critical if those two areas are sharp, but the shape, not just of the lengths and the distances, but also the curvature is what's critical. Some people have a low body weight, but an angle that curls in, and no matter how much weight you lose, how much lipo we do, we won't be able to define that area. Similarly, if our chin is recessed or small, we can have a really low body weight and the distance between the edge of your chin and your windpipe or the hyoid bone, which sits at the very corner of your neck, won't be as long. In these circumstances, we can extend this area. Now, let's take a step back. What if you don't want to do an implant? Well, there's an alternative where we're actually just moving the bone. In terms of the chin, this would be called a genioplasty. In terms of the jaw, this would be called a bilateral sagittal split osteotomy, or basically moving the entire jawbone. The cons of those surgeries are they're unfortunately a lot bigger surgery. When we have to cut bone, we're looking at a not just more expensive, but really a more invasive option. Everything moves it with it, and it can give you a more customizable approach. But when we take a step back, we're going to learn that an implant can accomplish a lot of similar things. Now, when it comes to a chin implant specifically, I have other videos that you can see here and some results that we've posted where you can see how much of a change we can get, but you're always limited by what the implant can do. The maximum size of an implant is about 1.2 centimeters, which would be an extra large implant in specific types. And you're also limited in exact shapes. So if you have significant asymmetries, an implant isn't going to correct that. Similarly, with jaw implants, we're specifically talking about implants for the sides. We call this mandibular angle implants. In these circumstances, we're going to be able to lengthen or widen or do both, but we can't really adjust it beyond what's prefabricated. When it comes to fabricating implants, now we're talking. There's a specific implant called a custom wraparound jaw implant. This includes the angles, the sides, and the chin. These implants are 3D printed and customized by the patient. They can provide spectacular results, and I'm going to link a surgeon who does great work with this, Dr Dhir, and I'm also going to show some of his results. These results can be dramatic, and they're customized fully to add symmetry and to be able to move things around. Now, the biggest difference between doing that and just a chin implant is going to be the level of results we're looking for. In order to define soft tissue, we can do that by doing lipo or a deep neck lift, but your framework is still limited to what you have. If you're already super thin and you want to adjust the framework work. Sometimes a custom 3D implant is the way to go. Remember, the 3D custom implant, while an awesome procedure, you have to be asleep. It's placed intraorally through inside of the mouth, and there's a little bit higher risk of infection, but because it's so big, it has to be placed in 2 separate parts, and that's gonna take a little bit longer and also a little bit more intensive. Now there you have it. There's some of the pros and cons of each approach. Overall, it's a very complicated process, and you have to figure out what's right for you. There's options out there, as mentioned, from a customized 3D implant to just a chin implant, and you can add on jaw angle implants. Overall, I'd say the jaw angle implants are limited because you only have 3 types in 3 sizes of each, whereas with the chin, we have over 10 different styles with 3 to 4 sizes of each styles. So without customizing it, more likely than not, we can find out what's right for you. As mentioned, the alternative is to move and reposition the bone itself. And while more expensive and definitely a lot more invasive, requiring a lot more downtime, those approaches can also be customized. Overall, I guarantee there's something out there for you. The best way to figure it out is start with multiple consultations. Feel free to leave a comment below. Make sure you hit the subscribe button and give this video a like. Thanks for watching this video and look forward to meeting you soon.